おはようございます。Good morning, everybody online and here physically. ようこそ3日目の SIGGRAPH Asia 2021年。Welcome to the third day of SIGGRAPH Asia 2021. So to kick off the third day, I am super hyped to welcome Matt Omernick, who is the co-founder and chief creative officer at Akili Interactive. Where he will introduce to us the story behind creating the world's very first FDA Approved prescription video game EndeavorRX。で、3日目の、初っ端にですね、基調講演として、マット・オマニックさんを招待したいと思います。で、彼は、アキリインタラクティブという会社の、共同創業者であり、チーフクリエイティブオフィサーであって、そのアキリインタラクティブという会社は、世界でですね、初めて、FDA っていうのは米国食品薬局だったと思いますけどもの、認可を受けたデジタルメディセンですね、処方されるビデオゲームというものを開発した人です。And it's especially significant for me because I was looking back on emails, and I just found out that I first met Matt through a email communication almost exactly 10 years ago. Actually, almost exactly 11 years ago, December 8th in 2010. And this is when we started working on a game that he was art directing called Star Wars: The Force Unleashed when Matt was with LucasArts. で、すごく僕にとってパーソナルなところで言うと、マットと初めてEメールのやり取りをしたのがちょうど11年前、2010年の12月8日だったと思うんですけど、その時彼はルーカスアーツ、ジョージ・ルーカスのゲームズ部門ですね、でアートディレクターをしていて、で、私の会社ポリゴンピクチャーズが、彼がアートディレクションをしていた「スター・ウォーズ・フォース・アンリーシト」という、ゲームを受注してたんですね。でそのプロジェクトについて初めてやり取りしたのが彼との初めての出会いでした。で、その後彼はさまざまな、A タイトルのゲーム、スター・ウォーズ・フォース・アンリーシュもそうですし、スター・ウォーズ・バトルフロント、あとメダル・ボーナーとか、本当にさまざまなゲームでアートディレクションをした後に、10年前に、全く違うデジタルメディスンという、領域に、での、起業したと。でこの本当そのものすごい話について皆さんに、今日共有できるのと本当に嬉しい感じてます。And after having a very illustrious career in the games industry, art directing, where he worked on A-list games like Star Wars Battlefront and Medal of Honor, he jumped industries in the world of digital therapeutics almost 10 years ago. Yeah, I think it's 10 years ago. And so I'm super excited to be able to hear his story of his wonderful journey that I think will inspire us all. So if I can bring Matt on. Hey, Matt.
Hello. Good morning, Shuzo-san. And thank you for the kind introduction. I'm sure I'm not the first person to say this to you this week, but I'm sad I could not be there with everyone. Yeah. But really, really privileged to be here. And I can't wait to tell you our story.
Absolutely. Thank you for being here.
So I believe we're going to start with the pre-recorded video. And we've left a good amount of time for Q&A, which makes me very happy because I find that with this very new concept, that there'll be a lot of questions, I hope, and I can talk about it all day. So looking forward to it. Good morning and welcome to SIGGRAPH Asia 2021. I cannot express how honored I am to be speaking to you today and want to thank the organizers and all of you for your interest in the work that we're doing at Akili Interactive. So today I'd like to talk to you about video games as medicine, which may not seem super obvious right away, but hopefully you'll walk away today with a better understanding of what that actually means. My name is Matt Omernick, and I am the Chief Creative Officer and co-founder of Akili Interactive. We founded the company in 2011 on the premise that we could combine two very different industries. And here you'll see a sampling of that. We wanted to create a company based on two pillars. First, the most rigorous and validated science. Secondarily, the most engaging and interactive experiences. And to do that, we combined entertainment, games with healthcare and medicine. And it's a little daunting at first when we posed this idea to combine these two very, very different industries, but we knew that this would be our greatest diversity, our greatest strength, and our greatest power, as well as our greatest challenge. And we've done so. To describe us best, I'll talk about our purpose. Many companies would call this their vision statement. And our purpose at Akili is to ignite new hope for those living with cognitive impairments and boldly challenge the status quo of medicine. We feel like technology has lagged behind often in healthcare, and that so many of the advancements and so many of the tools that we have in technology now can be used to kind of reinvent the way we think about medicine and the way that we interact with medicine. Our CEO is often fond of saying that medicine doesn't have to be scary. One very important thing to note here is that if I had to define what kind of company we are, I would say that we are a cognition company. We are focused on the belief that brain function is the next frontier. We know from the neuroscience that cognitive health is just as important as physical health. And we know there will be a future where that is true for all of us. And we want to fast forward that future. We want to bring that closer. And we want to use every tool that we have in our toolboxes to make that future happen. Much more of my presentation today will be more upbeat, but I think it's important to talk about the state of the world that we're in today. And we're struggling. Cognition, I think, is an underappreciated compounding effect on society. And we're seeing that show up in ways that we haven't before. And it's not just because we're seeing it more, it's happening to us more. We live in a world where we're continually bombarded by more and more stimuli. There's a lot of challenges. We've been in a pandemic here that I think has highlighted the importance of our cognitive health. And as a cognition company, what is still fascinating to me after 10 years is how deeply cognition crosses into all different types of diseases and different populations in different areas, some of them really surprising. So I'm going to talk about a few of those today and what we want to do to help. Across the world, World Health Organization states that there's 978 million people suffering from cognitive-related chronic and acute mental health issues. This is a big problem, and it's something we can help with. So as I mentioned before, technology isn't really helping. All of this new stimulation is challenging for us as humans. As our co-founding neuroscientist would say, we're primitive brains living in a modern world. And the fact is, that is what it is. A lot of this incoming stimulation, a lot of this distraction that we're being constantly kind of fed is something that we're not built to cope with. However, what do? Do we run away? Do we try to go back to the Stone Ages and just wipe technology out? Absolutely not. Instead, what we aim to do is fight fire with fire. Let me tell you how. So I want to introduce to you EndeavorRX, which is the world's first prescription video game. Very exciting. This is also the world's first FDA cleared video game. And it's an achievement that we are extremely proud of at Akili for both us, the world, and this as a new industry. However, this is really just the beginning. So EndeavorRX was designed to be a treatment for pediatric ADHD delivered through a video game experience. I mentioned clinical validation and rigor, hugely important to us as a company. Just a quick sampling you can see here, we've run over 20 clinical studies. We've been published in some incredible journals. We've studied 9 disease populations at this point, well beyond ADHD, all across that spectrum of cognitive impairment. We've even partnered with Shionogi, who has run an ADHD trial in Japan, and that trial has completed with positive results. So we're very excited to see what happens next there as we move into areas like Japan, Taiwan, and beyond. I'm going to show you a couple quick videos to hopefully help set the stage for what we're doing here.
When Emily was around 3, I noticed that she didn't have the vocabulary necessarily as other kids her age.
Early on, Kate was really resistant to learning. I was hearing things about self-esteem. She was making conclusions about herself. You know, I'm just dumb and other kids are doing this and I can't.
As a single dad, it is challenging because I have found there's only so much one person can do. The reason I thought Endeavor might be helpful is because of the gaming aspect of it.
I really liked early on watching her play and seeing how colorful and interactive it was.
The idea of having an ADHD treatment available in your own home, on your own device, in your own time is really fantastic.
And here's another.
My son Dylan has ADHD, which causes him to focus on things he's passionate about and not always on what I need him to focus on, like homework or brushing his teeth. But when he's talking about vegetarian dinosaurs, his face lights up, and I would never want to change that. That's why Dylan plays EndeavorRX. It's the first doctor-prescribed video game treatment for ADHD, proven to improve attention.
So I'm proud to say that EndeavorRX is currently being prescribed by doctors in the hands of patients, children, family, and helping today. But as I mentioned also earlier, this is just the beginning. But before we go there, let's talk about how this all started. From my perspective, this began when I met Dr. Adam Ghazali nearly 20 years ago. He and I met socially, and Adam even at the time, was an incredibly respected neuroscientist, and today is rock star status in that. Adam is also an incredibly creative and visionary person, and also a gamer. When he and I met, we immediately started to pick each other's brains. I said to Adam, take me to UCSF and scan my brain. And Adam, take me to LucasArts and show me how games are made. Adam always had a vision that games could be powerful tools for changing the brain. He has deeply understood for a long time that it is experiences that do change the brain. At the same time, there were other neuroscientists starting to look at off-the-shelf video games with the suspicion that maybe they're not all evil. Maybe they could be wielded as powerful tools and may have benefits. Dr. Daphne Bavalier did a wonderful study looking actually at the game Medal of Honor, which is a franchise that I worked on early in my career at DreamWorks Interactive. And it showed that even though this was a first-person shooter, which could easily be looked at as a negative type of game, she showed improvements in visual acuity and reaction time from folks that were playing first-person shooters versus those who were not. So some of these early indications that games could, in theory, be powerful tools were starting to bubble up. Where Adam had the real vision was taking that a couple steps farther. What if we built something from the ground up with very precise, targeted purpose to change the neural network of certain parts of the brain? And so he called me up, and I brought some folks over from LucasArts at the time, and Noah Falstein, who many of you may know. And we worked some nights and weekends at UCSF to develop a very early prototype called NeuroRacer. And I reluctantly would call it a game at that point, but that was the idea, is to create an experience that was interactive, real-time, data-driven, that could do a couple different things. Adam believed that a video game could be built to be sensitive enough to do one very particular thing, which was measure cognitive abilities in people and be able to detect the difference of the cognitive abilities of people as we age. That alone would have been a cool study. The second part that he really believed could be true was if we could detect that cognitive decline, could we target it and could we improve it? The answer was yes. And that study ended up on the cover of Nature, which I didn't fully appreciate at the time, but That's the equivalent of an Academy Award for neuroscientists, is to land on the cover of Nature. But it really showed that brains, neural networks can be specifically and predictably activated. So here's some results from that trial that show on the far left, you'll see that the x-axis here is age. So this was a trial that looked at folks in their 20s, their 30s, 40s, 50s, 60s, all the way up, I believe, into their early 90s. And first and foremost, they took a battery of cognitive tests that gave a really solid impression, right, of someone's cognitive abilities, tests that have existed for a long time. And then they played the game for a month. And what we saw was a couple different things. Number one, that game was absolutely sensitive enough to detect the cognitive decline of folks over the age, all the way down to 90s, as you see this trend downward. It also showed what we sought to do, which was to see if we could bring those cognitive abilities back up, even in the aging groups. And if you see on the right, a little bonus feature here is that the durability or the strength of that effect lasted beyond that month of play. The patients that went through this clinical trial came back 6 months after they had played the game and took the same battery of cognitive tests that they had taken in the pre and the post. They took it a third time, and it showed that the effects that they had were still quite lasting. They had dipped a little bit, but they were very strong, which is very different than a lot of the treatments that exist today, like pharmaceuticals. So Adam and I were very excited about this. Before the Nature paper launch, we already knew that this was a real new medicine that had a safety profile and efficacy that was worthy of bringing to the world. So how do we do that? This is where our CEO, Eddie Martucci, came in. So Eddie really brought the vision for not only how to bring this kind of technology into the world, but to how to build this as a business, and how to take that idea and expand that well beyond just aging and just cognitive impairment into these other disease populations. We also brought in Adam Piper, who many of you may know as well from Lucasfilm fame, brilliant engineer and designer that we'd worked with for years. And we were the first 4 co-founders and employees at Akili. I also called right away another gentleman that you all may know named Glenn Entis, co-founder of PDI, and a legend, I will say, in our industry, an incredibly creative, passionate individual who I immediately said, Glenn, you need to know about this. Can you help us? And so Glenn has been a trusted and loyal and wonderful advisor ever since. So in the end, we wanted to create a new kind of treatment, a new kind of medicine that was accessible and, not to mention, possibly engaging and fun. And we got a lot of eyebrows raised back then when we said we want to create FDA cleared treatments, and we want to have these prescribed by doctors. And we think that they can be enjoyable and not clunky and not difficult. Our CEO, Eddie, is famous for saying that medicine doesn't have to be scary. So this is what we sought out to do. How does it work? Here's a quote from Adam that I think is really insightful and specific into how our actual systems work. What science has known for a long time, what neuroscience specifically is known, is that closed loop systems are the most powerful way to change anything, whether it's physical or biological. So what's really interesting about how this game works is its closed loop system. Let me walk you through this. So here is an example of your brain. This is your cognitive abilities. This is your brain firing your strengths, your weaknesses, the things you can do well, the things you could probably be better at. The very first thing that the game does is an analysis. It does a baseline assessment of those cognitive abilities, of your cognitive abilities, at a really fine detail. It takes you essentially through a gameplay test that's testing you in different parts of the experience, sometimes in isolation, sometimes overlapping and together, to really get a fingerprint, for lack of a better term, of your cognitive abilities. Then what it does is crunches that through our system to actually design the game. And this is super cool. This is something I would bring back to the games industry immediately, is that every experience that someone has with EndeavorRX is different. Each person's cognitive footprint determines which rewards that they're going to receive at what frequency, at what challenge level, so that it's dialed in to really push the brain plasticity like a personal trainer would. A physical fitness exercise like analogy here is not perfect, but it kind of works. If you went into the gym and just lifted 3 pounds for 2 minutes and walked out and said, I had a great workout, that's not really doing you much good. Sometimes you need a personal trainer. You need someone that's pushing you, encouraging you, rewarding you, but making sure that you're tearing that muscle, that you're actually making change happen. So the game is designed to find out where you stand, find out what muscles need work, and then to push on those particular areas so that they can grow and expand just like in a physical sense. And so what the game does is creates a continual closed loop between all these things I just described. So it's constantly assessing your abilities, checking in on them, crunching that data, recreating rewards, giving you the proper challenge, rewarding you with all the goodies that we know in our industry work so well, and then continually feeding that loop back over and over again. And it's the power of that system that makes this truly a treatment that is really effective. Here's another quick look at that. You're seeing here a couple different examples of some of the tasks that people are asked to do, sometimes in isolation and sometimes combined. So they're navigating, they're holding a device, they're doing a continual motor task that is demanding of a certain part of the brain. And at the same time, they're being asked to discern and look for different targets, react to certain ones, and to inhibit their response to certain targets at the same time. And it's hard. It's not easy to do. This game is not Fortnite. It is not the most absolute fun game anyone's ever going to play. It's definitely the most fun medicine anyone could ever play. But it is challenging by design to kind of keep you at that challenge level. So that closed loop system, this combination of these different types of tasks are repeated and enhanced and created in much more complicated ways as you move through the game over 12 worlds. And we have a lot of different features from great games that are built in to continue these different reward loops. So costume customization, unlocking new story moments, a lot of the things that you'd expect out of a great high quality mobile game exist here. Here's a video that I like to show. It's of a much older version of the game in kind of early prototype stage, but it's showing 2 patients in one of our studies. The one on the left is a neurotypical child, cognitively normal functioning. And on the right, we have a child with ADHD. And as you watch them play, it's kind of hard to tell if there's a difference you're watching until you overlay some data. And what you can see here, I'm going to oversimplify, but the red lines, the blue lines, the green are these different tasks and how well the person's doing at these different tasks together. And on the left, you can see these lines are pretty high. The green dots are pretty high. There's reaction time. And this person is able to kind of do these things fairly well together, tightly. And on the right, you can see a big gap between this. There's a lot of trade-off happening here we call cost. And that cost is someone really struggling to do one thing and instead kind of giving up on the other. And it's really fascinating to me still to this day. You can't really discern that from just watching the gameplay, but once you open the hood and look underneath at what's happening, it's very, very apparent. Another really interesting thing about this technology is that it spans well beyond one specific disease. You see on the left, this little brain. At Akili, we refer to engines, not to be confused with Unity or Unreal in the games industry, but we have our own engines that are a set of algorithms and stimuli that are intended to directly target a certain part of the brain. In this case, it's the prefrontal cortex with SSME, which stands for our Selective Stimulus Management Engine. And SSME is not, it's very attention focused. That is really the purpose of SSME. It's to improve attention, our ability to filter incoming stimuli, to be able to ignore distractions, and to really strengthen that part of our brain. And that is not unique to ADHD. Attention issues are actually quite common in a lot of disease populations. Depression, anxiety, a lot of these areas have a shared impairment where we've got a lot of incoming information. We have a hard time prioritizing what's important. Oh, is this really bad thing going to happen to me? That probably isn't. Several other examples that where we're really just trying to prioritize the stimuli that's coming in and say, this one's important, this one is not. So my point here is that our engine can span across diseases, which is already cool. But what's even cooler is that that same engine can be repurposed under the hood of multiple different game types. So a game like EndeavorRX that may be enjoyable and engaging for an 8 to 12-year-old, which is the indication, is wonderful. But that might not be the best experience for an adult with ADHD or someone with depression or MS. So what we're able to do is maintain that core engine and yet build new game experiences around that engine that look and feel different and are catered to the audience. So really powerful, really exciting. Now I'd like to talk about why video games, I believe, are the perfect vessel with which to deliver this kind of treatment and this kind of medicine. As I alluded to earlier, we do know that it's experiences that change the brain. Sometimes bad experiences, PTSD, sometimes great experiences, some of our favorite memories. But interactive experiences can give us control over that change. So the number one reason, in my opinion, why video games are so powerful here is that they are the most powerful tool that humans have ever created to deliver impactful experiences. Movies also are wonderful, but they are passive. They're not requiring the user to interact, make decisions. The immersion level is very, very different. So video games are a wonderful creation by our species to be able to make experiences. They're very accessible. The ubiquity of devices across the world continues to increase every single day. People have access to this technology, and it's already part of our lives. We're playing games, whether we know it or not. I sometimes meet people who say they're not gamers, and yet they're on their iPhone, and I see them interacting with this wonderful interface that has reward and feedback and input. Games are becoming ubiquitous in the same way that smartphones are. They're engaging, enjoyable. We know this. They have built-in reward and challenge and reward loops. They have deep real-time and long-term data collection. This is also really important. Traditional medicine, in the case of, I'll use pharmaceuticals as an example, you're not feeling good, you go to the doctor says, well, we can try some things. How would you like to try this drug? Sure, let's give it a shot. You spend 3 months, you come back, you see the doctor says, how you doing? I think I feel a little better. Okay, let's try tweaking it, come back in 3 months. That's not a lot of data points. With these devices and with these types of technologies, we're getting constant feedback and information and data. We're learning more about these diseases at an incredibly high rate, and we're learning how to adapt them and change them to each individual so that they're getting the best medicine for them, and in many cases, the best medicine that tastes just right for that person. They're also infinitely customizable and personalized, which I think we've covered that in a couple of different ways, but the ability to be able to fine tune these to that level so that each individual is getting their own custom pill, for lack of a better word, is extremely powerful. And not to mention all the work that everyone here at SIGGRAPH and beyond is doing, we get to leverage that. We get to ride the coattails of the improvements in technology. And we're grateful for that. We have a studio of 100 people at Akili right now. We're growing. We have a lot of exciting things going on, but we're looking to expand and grow our ability to make these games not only more efficacious, but more engaging and more beautiful and more fun to play. There's a few really exciting things that I wish I could talk about today that we'll announce hopefully soon. But I will say that we are actively talking with game companies about really cool partnerships ideas, not only with the concept of potentially integrating our technology into other games, but to help kind of develop and push this incredibly new category of medicine and entertainment even farther. We also, I think it's worth mentioning that beyond our single engine of SSME focused on inattention, we have other engines in development beyond this. We have engines in development for spatial navigation, looking at dementia, Alzheimer's, Parkinson's, and body-brain trainer that we call BBT, you see down below, is a combination of physical exercise and cognitive exercise. The hypothesis there was that if you were doing both, all boats rise, and that you're going to get benefit even greater by doing these together. And all signs point to that is true. So we're looking forward to integrating those into experiencing games as well. There's a couple of quick examples of that. So what I do want to leave you with here is that, again, this is an entirely new industry. This is an entirely new category of medicine and entertainment. And it's often called now today digital therapeutics. This is a term you may or may not have heard. A lot of people have heard of digital health, digital medicine. They're kind of subcategories, and getting down into the nitty gritty here, digital therapeutics is squarely where Akili is at, along with many other companies. So there's the Digital Therapeutics Alliance that we are part of, as many companies, more than you see here, are really trying to set the bar for the highest clinical rigor and validation, knowing that this is real medicine and needs to be seen as such. There's many other companies beyond that are really doing incredible things with VR, with games, with immersive experiences to treat things like amblyopia or physical therapy, lower back pain. And we're starting to see FDA clearance and prescriptions of many of these. So this industry is really, really gaining tremendous traction. And from our point of view, the more the merrier. The sooner we have more engaging, accessible, safer, and effective treatments, and the sooner we can move towards that future, the better. I do want to show you one quick thing in closing. This is just kind of a fun, pseudo-unrelated experiment we did early on called Glass Brain. What you're looking at here is Dr. Adam Ghazali's brain. He was put in the fMRI scanner, and what came out was a 1,000,000 polygon version of his actual brain, which then I went and cleaned up and optimized so that I could run it real time in Unity. And what you're seeing inside the Glass Brain here is a simplified version of the neural networks. And you're about to see some lights start to go off and some particle effects start to fire here. What you're seeing there is actual brain activity taken from an EEG headset, playing back in real time inside Adam's brain while he plays one of these games. So we're zooming in on this, we're going through, we're actually seeing in real time what parts of the brain are lighting up as you're experiencing these interactive experiences. And what's extra cool is that I think in this case, there's VR goggles on. So imagine you've got VR on, you're actually traveling through your own brain as you're getting stimuli, and you're seeing how that stimuli is firing in your own brain. So just a really cool example and a showcase, I think, of the way that we're trying to think about a lot of these different things. So I do want to close with, if this isn't obvious, I believe it's a really exciting time. And I believe you can use your powers for good in this industry. Thank you so much. I look forward to Q&A.
Thank you, Matt. Man, that last film, the short, that was super trippy.
That's a good word for it. Absolutely.
That can perfectly fit in like a coffee, tea, or like XR showcase. That's super nice. Thank you so much for the talk. First of all, when I was preparing for your talk today, I just found that you were part of Newsweek's inaugural list of America's 50 greatest disruptors for co-founding Akili Interactive.
Yeah, that was news this morning to wake up to, which was very cool.
Yeah, congratulations, man.
Thank you.
So
incredible 10 years.
Yeah, no, absolutely. So before I open up the questions to the floor and also to our online platform, I'd like to ask a few questions of my own. Primarily targeting towards having the audience know more about you, because you've touched very little about yourself. で、Q&A 始めたいと思います。で、いつも通りですね、こちらの会場で、質問がある方は、こちらにマイクがありますので、そちらに、移動してください。で、ちょっと時間の問題もありますので、あらかじめ、移動して、質問をされる準備をしていただければというふうに思います。For those of you who are in the hall, want to ask questions, please be in front of the mic, so that I know that you'll be there. And also for those of you who are watching us online, please throw your questions on the Delegate Connect, and I'll make sure to pick it up. So firstly, Matt, why, tracking back, why did you decide to become in the world of games? And has that kind of sense of purpose, or that desire, is it continuing on? And if so, how in the world of digital therapeutics?
Sure. There's a couple reasons, Shuzo, when I try to look back at the trajectory and kind of what has led me this direction. I would say the most obvious and striking one is that growing up a gamer, growing up an artist, it always bothered me the stigma of video games. The idea that video games, we heard this early days in Akili from an older doctor once. He said they're the devil's instrument, right? So the stigma that video games had even growing up, and it's thawing every day, which is wonderful. But that always bothered me. I suspected them to be something much greater. I was very excited about the future of seeing how they would develop, seeing every advancement in real-time technology, and just had a strong intuition that they were going to be something much, much bigger than the very narrow stigma that existed. So I always had that kind of inside me and wanted to combat that. Secondarily, I'd always been interested in the brain. Growing up, read a lot of books about the brain, and now that I look back and I know myself a little better, I've learned about myself that I love unsolved problems.
Okay.
I love the unknown, and the brain is absolutely something that is still very unknown. So I'd always been attracted to that. And I think it's the same reason that I moved into games, even from film, was the unsolved problems there, right? Trying to make something look incredibly good in real time and from 360 degrees. So I started to see a pattern in who I am as a person, as you're asking. It's just seeing an unsolved problem and running at it instead of running away from it. So that kind of adds up for me at this point.
That's interesting. And you said that you came into this world, in your talk, you said that you came into this world of digital therapeutics just by a chance encounter, right? It wasn't something that you were like searching for.
Yeah, absolutely. I think I was primed already, given everything I just described to you, when I met Dr. Ghazali. And it was at a party in Berkeley, in the Berkeley Hills.
Okay.
And I had been living in San Francisco for maybe a year or two, and he had recently moved there, and we just through friends started chatting. And as I described before, there was a mutual fascination club happening immediately. And even back then, the idea of these merging and being used together, these two industries coming together, was very exciting. So I think the seed got planted way back 20 years ago. And given that first opportunity and seeing the data that was coming out, it was an easy decision for me to say, okay, I need to go do that.
Awesome. Connecting the dots, as Steve Jobs would say.
Yes, absolutely.
So we have one question from the floor. Dozo.
Okay. Hi, my name is Koji Suginuma with Eizo Shimbun and also Nihon University. And thank you very much for the excellent lecture. I appreciate. And so also I want to say congratulations to you or your achievement. And my question, I have two questions. So you said you started this idea by chance to meet the doctor at the UC SF, but there might be something accumulated on you to jump into that idea. So what was that?
Cumulative was the word used. I like that. I think I kind of spoke to this a little earlier. I think it was a buildup of many things and learning about myself and learning about what inspired me and intrigued me. I would say the other thing I forgot to mention, which is incredibly important, is I have a family now. I have two daughters, 9 and 7, and a wonderful wife who Shuzo knows very well. They've worked together in the past. And my wife and I actually met at LucasArts, which is a really, really cool story for another time. And as I started to think about having a family and that started to get real, I really started to think more about my future and what I wanted to do. And I started to think about my kids, and I started to think about their future and their mental health. And I'm so proud of all the work that I've done in the traditional games industry and would never change any of that for a second. But the chance, said, to be able to use those powers for good and thinking about my family and then thinking more broadly than I had in my younger days, I think that was tipped the scales for me as well. So yeah, absolutely a build-up over time.
I see. Thank you. So as a father, I feel the same thing. Also, my second question is about the FDA. And what was the most difficult thing during the FDA process?
Great question. So what is the most difficult thing about the FDA process? Well, from the very beginning, as I mentioned, just the idea of us deciding to go that route was, a lot of people just said we were crazy, if I'm honest. As I said before, there was a lot of raised eyebrows. A lot of people said, you're asking for a lot of pain because it is a long, difficult, challenging road. Certainly, but we decided that from the very beginning of the company's inception. We knew that this was real medicine that had to get into the world. And we knew this medicine couldn't be confused with anything else that might exist. Brain training and some of the other things, or Sudoku or things like this. This was real medicine, these were real treatments. So we believe that not just for the good of Akili or for the good of this particular technology, but for the good of this industry, that we needed to validate this. We needed to make sure that this was understood deeply as true medicine, the true medicine that it is. So going the FDA path, going the prescription path was the best way that we knew to be able to do that. And so I would say the most challenging part was the decision to do that, and then putting in the work to do it, because no one had done this before.
Right.
And a lot of questions along the way that we had to help answer ourselves. The time it takes to go through an FDA process, I think it was almost 2.5 years for us from when we submitted to when we were actually cleared by the FDA. And that period of time is fascinating because you've done the great studies, you have the great data, it's all out there, and yet you're waiting, and you don't know when you're going to hear back. And so when you're running a business and you have a major milestone that is completely out of your control at this point, it's a very unusual experience for me. So I would say it was the time, the work to go into it, the very big, large, expensive, robust clinical trials that we had to create to prove this out, and then that kind of strange waiting game until you actually finally hear back.
I understand. Thank you very much. Now you are getting rewards. Okay, very good. Thanks.
Thank you for the question.
That's the beginning. Yeah.
I have a question from Shohei Komatsu, who is online. He says, I'm working on a VR, Digital Therapeutics startup in Japan. I think it's important to mix engineering and medical elements to create digital therapeutics with video game elements. Is there anything you have tried to do in this regard?
Thank you for the question, and I agree wholeheartedly about the importance of mixing these together. I'm assuming the question is specifically about VR. We have R&D projects. We have historically with VR. We do believe, for kind of obvious reason, I think that the immersion level again with VR and MR and AR can be even deeper than what you're getting in a two-dimensional device. So the theory that if we can create engaging experiences that change the brain, could we create even deeper, more engaging experiences in VR? We believe the answer is true. So we've really experimented with quite a few things, but to be honest, we've been waiting for hardware and for just kind of the ubiquity and accessibility of VR to kind of catch up. A big part of our idea here is that we believe we can make this medicine accessible to so many more people who do not have access to traditional medicines all the time. And so that's really a foundational thing for us as a business. So as VR has gained a lot of traction and we're starting to see a lot of really cool advancements in that space, absolutely that is a target for us. It's something we're super interested in and always keep on the R&D edge.
Thanks. I mean, just in addition to that question, so in the current case, how would the patients take the medicine? What do they take the medicine through, the medium?
It is through devices, so Android or iOS, phone or iPad. We run on pretty much all the most common devices right now.
Cool. We have another question from the floor, please.
Hi, Matt. My name is Stephen Estelle, and I'm a mechanical and biomedical engineer from the United States. But currently, I'm doing engineering work at the Okinawa Institute of Science and Technology. And we're currently doing similar research that has a lot of overlap. And one thing that we are kind of encountering that I was curious about was patenting. So this is the first question of my two, is when coming to patenting your devices, how do you choose which countries to patent in? Have you guys had a conversation about that?
Sure, thanks for that. I wish our really talented legal team was here to give you a more in-depth answer on that.
Yeah.
I can say that we've been very aggressive about patenting, this extremely new technology. I think we have 52 granted patents today worldwide, and 102 total, I think, when you count pending. And they're not just United States. We're trying to strategically, of course, we want to bring these technologies, this medicine, to anyone in the world at some point. So really trying to lay the groundwork there. The challenges, as I've understood them sometimes, is that, again, because these types of things had not really existed before, there's not a ton of precedence for these types of things, which again is the reason you would want a patent in the first place. So I wish I could give you a little more in-depth answer, but I would summarize by saying it's a really important part of what we do.
Okay, that makes sense. And then I believe earlier you mentioned about all the different organizations that are trying to work together. Is there like a specific group that people are trying to collaborate with, or that people are trying to come together and bring their ideas? And yeah, what's the group and things like that?
Yeah, it was kind of maybe mixed in the logos that I'd showed, but on the upper left, it's called the Digital Therapeutics Alliance, the DTA.
Okay.
And it is an alliance that was spun up in the early days of this, and our CEO is chairman of this alliance, and they're doing tremendous work to help define, again, set the clinical standard and rigor for these types of medicines. They're doing things with legislature. It's a wonderful collection of companies, and a lot of work goes into that alliance to help define and kind of clarify and validate this entire industry. So it's a great place to start. I only showed a few logos from a few of the companies that are in there. Applied VR was one, back to the VR question, who just recently, I think it was last week, got FDA clearance for their device, which is a VR digital therapeutic game for lower back pain. So yeah, there's some really exciting things. Go check out the DTA Alliance website.
Okay, thank you.
Thanks for the question. So I'd like to pick up. あと、こちらの会場で他に質問があればぜひまた時間がありますので、マイクの方に行ってください。I'd like to pick up another question from a viewer online by Alberto Tono. Any plan for digital therapeutics for XR? FDA clear, especially for children under 13 years old. Also, you focused on attention. Do you think this could help for pain reduction? And if so, how would you measure it? Sorry,
sure.
It's a loaded question.
I'm not going to try to put on a neuroscientist hat that I don't own and answer the how would I measure it question. However, I believe that there's quite a bit of work actually going into pain reduction already using, as mentioned, VR for sure. There's been some great physical therapy work that's been done. And yeah, I don't know much more to say than that. Again, the Digital Therapeutics Alliance would be a great place to start to dig into that. At this point, I'm actually having a hard time keeping up with some of the new companies and technologies and some of the great different disease populations that folks are helping. But certainly physical therapy was one of the earlier things that we saw start to come into play, especially with VR. So really exciting space, and I'm sure tremendous developments underway and coming soon.
Awesome. I have another question. Since this is in Japan and you had Shionogi in your slide, if you can say anything about the collaboration that's currently going on with Shionogi, and if you can talk about it, if any, the process of your medicine, digital medicine, getting sort of FDA approved here in Japan.
Right. I mean, that would be our hope, of course. So as I mentioned, the partnership with Shionogi, they've been amazing. We were able to co-develop with them for their clinical trial, which really is very similar in scope and scale and rigor to the massive one that we ran here in the States. And so that trial has completed. We're happy with the results there. And so the next steps, I wish I could say what they are, but we're very excited. I can leave it at that.
Okay. And you mentioned in your talk that the depth and the width in which that this can be applied, but your first FDA approved medicine was for kids with ADHD. Why is it that was the particular focus?
There was a lot of reasons. As you remember from early in the talk, the originating technology was really designed for memory and aging and cognitive decline over the ages. So very obvious application there for mild cognitive impairment and some of the aging things, which of course are in our dockets and things that we study. But when faced with the question of what should our first population be, ADHD rose to the top pretty quick for a lot of different reasons. One of the ones I think is most relevant and most obvious is that we were introducing this idea, right? A prescribed video game is medicine to the world, which for a lot of people may be a little crazy sounding, right? But we're bringing this thing into the world. We wanted to make sure that it was as, I'll use the word familiar, right, as possible, that it was not a really crazy way out there type game, that it was something that looks like something that we've experienced and played before. And we wanted to make sure that we were bringing it into an audience that was going to be highly receptive to it, right? And we know with ADHD that a lot of kids already use video games, right? In some ways as an ability to focus, right? Many kids with especially severe ADHD can have a very hard time with the things around them in regular life, but if they get into a game, they are in it and they're in it deep. And because pediatric is where we felt that was an area that we could make an impact early on in the neural network. So there was a much, much longer list, but as we went through it, it was very clear to us that that was the right place to start. And that seems to be true. And now we're very excited to go well beyond that, both in ADHD to help the entire span of population, from younger than 8 to 12 to all the way up to adult, and then beyond. Thanks.
We have another question from the floor.
Hello. Thank you for your presentation. I have no medical, I know nothing about medical stuff, but I have questions about VR or video game itself. Do you think it's safe to match information to kids having ADHD? Because video game have many lighting or colors and movement, and also with the VR, kids have 360 video and much visual information. Do you think it's okay for like kids having such ADHD thing, and are they okay?
Sure. So it's a wonderful question. Thank you for that. As a big part of our studying this, both in the iPad and the VR side of things, that's really important to us, meaning video games for some people can cause nausea, right? They're in our clinical trials, it's very cool because we had no extreme adverse events, right? Things that were reported were sometimes like some dizziness or some nausea, but we spent a lot of time in the studying phase fine-tuning the game to reduce that as much as possible. With VR, that's another realm. That's another few more dimensions of trying to take that into account. But what's great is that now we've kind of built the systems and built the clinical trial apparatus to be able to test, these very, very small things and try to continue to improve those. And as I mentioned earlier, we can continue to iterate. So if we find that some certain colors and certain things are maybe changing or eliciting something like that, we can rapidly change them and we can remeasure to make sure everything is still doing what it needs to be doing and move forward. So yeah, it's absolutely fascinating. We learned a lot of really cool things along the way. And in case the question doesn't come up, I think it's one that usually does that's related is screen time, right? And game addiction. These are questions that we get often, saying, but wait, isn't this a problem? And absolutely, game addiction can be a major issue. It's something very real. Our products are, in the case of EndeavorRX, it shuts itself off after the 25-minute dose every single day. So the child is actually got their dose. They says, thanks, you did great today. We'll see you tomorrow. And that is like, they are locked out till this moment of time. So this is the fine level of detail that we've tuned these things to find the sweet spot for the right amount of exposure without, introducing a lot of the other problems that you might chase down.
Yeah. Thank you so much.
Thank you. We have another question from our online participant. Your engine has a lot of scope for use with other diseases. On the other hand, can you elaborate on the use of the core engine for use back with traditional games? I think
thank you.
Yeah.
Yeah, thank you. We as we were building this and looking at more engines and thinking about this, we were definitely very conscious of building it in a modular way, not only for our own purposes to be able to plug and play into these different populations, which I talked about earlier, but that idea of potentially down the road being able to embed our technology into other experiences, and not just other games. Something I wanted to put out there is that what we are really doing, if I back all the way up, is we're looking at ways that we can bring cognitive treatment into people's lives, into things that they're already doing and that they already enjoy and engage with, right? And that can mean a lot of things beyond just video games. So the point being, we built these in such a way so that we can modularize them. We've really built a platform here of both the process of bringing something through FDA clearance and clinical trials and out into the real world, but into creating a platform of technology that can be repurposed and reused and put to put in different places. So that's something that we're constantly talking about, investigating, and discussing ideas on how best to do that.
Awesome. I have another question. So you got it FDA approved. What's the process or the challenges having this digital medicine actually prescribed by doctors?
Yeah, well, one of them, as we were moving towards this path, was that the idea of a digital prescription wasn't really a thing. At Akili, we're famous for saying internally that we're constantly solving problems that haven't been solved before. And there's very little precedent for a lot that we do. There's parts of us that do look like pharma in the way that we work, which is great, leveraging what works there. There's part that looks like tech, but a lot of the stuff we had to invent or partner in this case. So in the case of EndeavorRX, we partnered with a fairly new, awesome company called Phil, P-H-I-L, that does the actual fulfillment process of the digital prescription. So again, to get EndeavorRX, it's not like you have to go to your doctor and sit down with them and then go walk down to the pharmacy and wait in line. And so we're actually innovating on so many more things in the journey of getting this kind of medicine than just the treatments. Our treatments are actually just a part of what we make. And another example that I'll use there is in the case of EndeavorRX, we have a companion app that we've developed called EndeavorRX Insight. And this is an app for the parents and teachers and doctors who are in the ecosystem around this child and who are affected by this child's impairments. And the app lets the parents put in symptoms and behaviors and at a really high frequency, whatever frequency that they'd like. And that is directly connected to the game itself. So they can see how the child's doing, see which costumes they've unlocked. We want, some of the features that we don't have in yet, which I'm very excited about, is really connecting rewards between those two, right? So if the parent wants to encourage the kid to have their dose for the day, they can put in a specific reward that they know that kid's gonna love, and that gets unlocked in the game. So these secondary kind of companion applications that we built are also collecting a lot of great information about what parents really care about in their kids' symptoms and behaviors. So that was a lot, but I think it gives you a glimpse of beyond just the treatments of the things that we're innovating on and trying to expand and create a journey that is enjoyable at every step of the way.
Wow. Final question, because we're running out of time, actually. Final question from a participant online. Besides traditional artistic contributions in game design, such as animation, concept, character design, etc., art is a powerful medium to streamline the aesthetics, interface, interaction to cater for specific demographics and medical treatment domains. Have you discussed this with your team? How do you see the future role of artists in this collaboration?
Wonderful question. Absolutely could not agree more that, aesthetics and art have alone, evoke tremendous emotion and experience. And there's a reason that I think art has become such an important part of games and interactive experiences, generally speaking. We believe art, sound, music, we even know this from the neuroscience, are profoundly effective in eliciting a response from us as humans. And so we invest heavily in our art and design at the studio. Like I said, we've got many more games coming down the pipe, and we want to continue to increase the beauty and the interactivity and the arts, frankly, of the things that we're building. So it's something that's really important to us. It's, I think, part of the reason why I exist at Akili in the first place is to represent that idea and to represent this industry and the things that we're all doing and bring that into the immersiveness of these products. So couldn't agree more.
Awesome. Thank you, Matt. With that, I'd like to close this presentation. Thank you so much for joining us. It's such a bummer that you're not physically here. We were this close, but we're making the best of the situation. Thank you so much. 皆さんもう一回マットに拍手をお願いします。
ありがとうございます。